Hi everyone. I am doing an impromptu little short live about the blood work analysis because I have had quite a few questions and um, consults regarding, kind of what the BWA is and what it includes. And so I thought I would come on and just do a quick little talk on what the blood work analysis report is so you guys could all see it, and then also talk about why I like it so much and why I find it so useful. Okay, so I think all of you can see it hopefully on my screen. Let me just check. Okay, I think you can see it. All right, awesome. So what you're looking at, this is the actual report. So when somebody gives me their blood work analysis, what I do is not their blood work analysis, when they provide me with their blood work, so the report that you get from your lab, what I do is take that information and then put it into my software that I have, which allows me to do a functional analysis, a naturopathic functional analysis of your lab numbers. And so this is what the report actually looks like. So I'm just going to quickly kind of scroll through and show you generally what the report looks like. And obviously, of course, this is all personal information has been redacted. So this is just a sample BWA report. But if you were to get a BWA analysis done, a blood work analysis done, this is what your report would look like. And it has all these different sections in it. And essentially, what I do is review with you the core data and what that means. And so I'll just kind of show you what is included in this report as we get to the core data. And so this report is really nice because it takes your information and then breaks it down into individual functionality, like where it's finding deficiencies or imbalances in terms of specific systems or specific nutrients. And so this is really helpful to get an idea of what is your blood work truly trying to tell you, because you can get a lot of information out of your blood work if it is interpreted properly. And a lot of times what happens is you get your lab report from your doctor, from your lab, and maybe one or two things will be outside of the range. And they'll be like, oh, everything's fine. Everything's good. Everything's in range. Well, the reality is that's not true. And here's the reason why. So here's the section that we're going to go over together. So this is what the actual analysis portion looks like. So this is the piece that I review with you if you were to get your blood work analysis done. And so I am now going to switch over. So this is the report. I just wanted to show you what the report is. This is what it looks like. This is what the actual information is that you get. So it's really detailed. It's really nice. And now what I'm going to do is actually switch over to an actual very recent patient that I had just yesterday morning, and I'm going to review with her specific results that I went over with her. So she is a 34-year-old woman, lovely lady. She is actually a cardiac nurse, and so she works in a hospital setting, and she is struggling with weight gain, swelling, menstrual cycle irregularities, a lot of GI stuff, not sleeping well, and some stress and anxiety issues. And so after her initial intake, then of course, I asked her to get her labs run, and then she sent me her labs, and then I take that information and translate it into this format. So this is the core data that I review with everyone. So what you're looking at here is you can see the actual results, right? So her results are the ones in the colored column. And then you'll see next to it there's an optimal range, and then there's a standard lab range. So what you'll notice is that the optimal range, what we want to compare your results to, are a much tighter, narrower range versus the standard lab range that comes on your lab report. And so it's much more useful to compare your result to the optimal range versus the standard lab range, because you'll notice that in general, most of the time, the standard lab range is a much broader range than the optimal range. And that is because the standard lab range that you see on your lab report and that you see here, it's typically a reflection of the population of the people that your lab is testing in your region of the country. So not necessarily healthy people, it's just kind of taking an average of all the results that are coming in and comparing you to those results, kind of the average of the people. So not necessarily healthy at all, and that's not a reflection of what we're trying to achieve in terms of your health. So we're trying to help you reverse issues, prevent issues from further escalating, trying to understand which systems are involved that could explain what your current symptoms are. Like, we can get so much more data or information from your data from your lab report if we just looked at it in this manner, in this more functional analysis. And so that is why I love this so much and why I find it so useful, because everybody has to get blood work done anyway. So might as well get useful information from it instead of having you go off and do a lot of expensive functional medicine testing. You know, we can get so much data just from doing this analysis. All right, so back to this patient of mine, who is, again, a 34-year-old lovely lady. She's a nurse. I have many nurses as patients and clients, and I think they just get it. Like, they see what's going on in the hospital setting, and they don't want to go down that route in terms of medications and the side effects that they're putting their people on. And so I get a ton of nurses as clients. And so this lovely lady came in, again, with a lot of main symptoms of, or health goals are losing weight. She has a good amount of weight to lose. I would say at least 60 pounds would be good. And then she's got some swelling, and she has some GI issues, a lot of gut symptoms, and she's really tired, and she's got some stress and anxiety. And then she's also concerned because her mother passed away from complications from diabetes. So she's really trying to look forward and prevent things if possible. And mind you, when she got her labs done and had it reviewed with her doctor, they were like, oh, everything seems to be okay. However, when I went through it with her, this is what we found. So if you notice, this is her blood work, and so when her result is within the optimal range, it will be in green. When it's outside of optimal, but still within standard, it'll be in yellow. And then when it's outside of both, it'll be in red. And so that's a nice quick visual to kind of really know where to hone in on. So this first top few markers are all about blood sugar regulation. And hopefully by now, if you've watched any of my previous talks, I really emphasize the need to get a full picture, a full understanding of what blood sugar is doing and how well it's being regulated. And it's not enough to just get fasting glucose and hemoglobin A1C. You really need to get fasting insulin. And so this was the first time she had no one had ever asked for it before, so we definitely ran fasting insulin. And her fasting insulin is elevated. It's almost double of where we would like to see it. So it's double, indicating that she has insulin resistance going on. Her fasting blood sugar is elevated, so that's an indication that there's already some signs of some dysregulation going on. But more importantly, this insulin resistance is the bigger issue. And so her cells are becoming resistant to insulin. They're pumping out more insulin. Her A1C is still fine, but that's not an indication of health. We want to reverse things. So, and then all of these other scores are a reflection of HOMA2 scores, and they're a reflection of trying to predict risk for prediabetes and diabetes. And so she is at an increased risk. Okay, so moving on down, I'm not going to go through everything. I'm just going to highlight a few things from her report. So that was really what I wanted to emphasize here on that first page. And then second page of her report, what I'm noticing is that she has something going on pretty significant with her gallbladder slash liver slash gut. Now, none of her other doctors, of course, mention any of this, but she has symptoms of she has symptoms of gut stuff. She has some IBS symptoms where she has alternating between constipation, and then sometimes she'll have days where she has multiple loose bowel movements. However, what I'm seeing here in her blood work is that her gallbladder is the issue. And again, no one has ever tested for this, number one, but thought to consider looking more, at her gallbladder. But a GGT of above mid-teens, I normally don't see it any higher than 12, 13, 14, somewhere around there. Hers is at 22. That is significantly elevated. And here's a perfect example of why you want to look at your numbers compared to optimal ranges versus the standard lab range. So the standard lab range for GGT is 3 to 85. That is such a huge range. Not very helpful. But the optimal range for GGT is, up to 17. So you can see that anything above 17 should start to be a clue that, okay, something's going on. We need to start considering, are things going on with the gallbladder? And so when I mentioned this to her, she was like, oh my gosh. She's like, I never really thought about it. But yeah, I do sometimes have pain in that area. So if she were to wait for her GGT to get to the point where it's above 85 for them to do something about it, that is significant potential damage to the cells, stagnation, stones forming, who knows. But so she definitely has something going on. And then to kind of further back that up in terms of what I'm seeing, look at all her lipids. So her cholesterol, her triglycerides, her LDL are all super low. Now, for someone who has insulin resistance and who has a lot of weight to lose, but her lipids are really low, again, this is telling me that she's not digesting, she's not breaking down, she's not absorbing her fats as well as she should be. And so this is how I look at markers together in the report. And this is why it can be so beneficial to give me insight as to what's going on and to step in now before things progress, because things are already in motion of becoming a problem and kind of moving down that road of becoming a potential disease state. But we don't want it to progress. So I'm so glad she had this done, because now we're seeing, okay, here's what we need to focus on. Here's the priority for her. And so this was big. And then there's a few other indications in here for digestion and absorption, and she has some specific nutrient deficiencies. But then the last piece that I really wanted to highlight in her report was her inflammatory markers. Again, typically they will not run these. So HSCRP, C-reactive protein, and sed rate are really good and important markers to get run if you want to gauge what's going on with inflammation in the body. And notice all three of hers are significantly elevated to the point where it's worrisome. So, and these are all outside of even the standard lab range, but they would never know that because they don't run these. They don't even ask for these. And this is why I always ask for these in baseline blood work that I want to review, so I can get the whole picture, so we can see what's truly going on. So we're not waiting for things to become a huge problem that then we have to take massive steps to try to reverse. And so, and again, just to remind you, she is a cardiac nurse, and she has significantly high inflammation in her tiny vessels related to the cardiovascular system. So as you can imagine, she was just like, oh my gosh, no one's ever done this before. I'm so grateful, because there's so many things that are clearly out of balance and need to be worked on. And her main goal is to prevent going down the same path as her mother, who passed away at a relatively young age from complications of diabetes and I think some level of heart disease. So This is why it's so important. This is why I love the blood work analysis so much, because it's just taking information that you're already getting, that you should already be getting from your doctor, from your lab, but it's looking at it, it's analyzing it in a much more useful manner, which I love. And so hopefully this provides you with a lot more depth and insight as to what the blood work analysis is and why I find it to be so helpful and so useful. And so this is why I run it on anybody who comes to work with me, whether it is one-on-one, if you are signing up just to do a health program with me, like initial intakes with the follow-ups and having a customized wellness plan, I will run a blood work analysis. If you sign up for the MHR, the metabolic hormone reset, I include this as well, because I just find it to be so helpful to know, okay, are there things going on that we should know about that we could also potentially keep an eye on or address at the very beginning of starting the MHR, or maybe you need additional support. So before you start releasing a lot of fat within the metabolic hormone reset, this is also helpful for me, so to know, and for you. And then for all my women who are in my fertility program and do a fertility package with me, they also, I always start with a blood work analysis, and you'll notice that there are no hormones here. I do run thyroid hormone, but I don't run estrogen, progesterone, FSH, LH. I don't run any of that stuff in the first blood work analysis, because as you can see, most of the time there is so much that needs to be worked on at the foundational level that's where I start. And even in her case, like in this particular client's case, she has hormonal imbalances. She has really heavy periods and just painful periods, really bad PMS, but it doesn't matter to me. I'm not going to do anything with her hormones until I fix her gut, her liver, her gut, her adrenals, her digestion, and get the inflammation down. And I can almost guarantee you, by doing that, the majority of her hormonal symptoms are going to go away, because that's what I see most of the time. So that's it. I just wanted to come on real quick and share kind of the details behind what the blood work analysis report is, and how I look at it, how I interpret it, how I use it, because I run it on everybody. And so I run dozens of these every month, and so it's so valuable and powerful. And so yes, it's included in any which way you can work with me. And if you just want to get the blood work analysis done and just start with that, you can do that too. That's totally fine. I've tried to keep it super simple in terms of how to get this done and how to work with me. So there's different options. All right, that's it for today. I hope this was helpful, and reach out if you're interested in getting the blood work analysis done. All right, everybody, take care.